All right, now that we've gone over Chapter 25 Airway Management, we're going to review and test our knowledge and see what we know about it. So, what would you think some non-invasive techniques that help maintain a patent airway would be? Things like hydration, positioning, nutrition, chest physiotherapy, deep breathing, coughing, humidity, incentive spirometry, and aerosol therapy. And then what would you think some invasive measures would be? Suctioning or inserting an artificial airway. So we use oropharyngeal suctioning, that's the type of suctioning. It removes secretions from somewhere in the mouth. Where does it remove secretions from? Back of the throat. And what type of patients would get oropharyngeal suctioning done? Patients who are able to cough effectively but is unable to clear secretions, such as like a patient with neuromuscular injury who cannot manage his or her own secretions, and then patients with artificial airways and impaired swallowing require use of the suctioning to provide oral hygiene. So, do you think you can delegate suctioning? Yes, you can, but not for patients with oral or neck surgery in the immediate post-op period. Also, nurses responsible for assessing respiratory status. So, what do we know about patients with chronic pulmonary diseases and like what happens to their SpO2 value when they're getting suctioning? It may stay the same after oropharyngeal suctioning. This baseline value may be lower than the typical normal values, greater than 95. So when it comes to suctioning pressures, what are we going to set it for infants? 80 to 100. What about for children? 100 to 120. And adults? 100 to 150. So if the patient during suctioning SpO2 value falls below 90%, respiratory distress develops during or at the end of oropharyngeal suctioning, what should we be ready to do? Provide supplemental oxygen, okay? Where do we want to store the suction, the yonker, when we are not using it? A brown bag or plastic bag attached to the bread rail. We don't want to get it contaminated. So let's say you're doing suctioning and patient's respiratory distress increases. What you're going to do? You're going to suction further or implement nasal or tracheal suctioning. Evaluate need for other means to protect airway, such as oral intubation, oral airway and positioning. Provide supplemental oxygen and notify a healthcare provider. And then what happens if bloody secretions are suctioned? Assess oral cavity for trauma or lesions. Reduce amount of suction pressure used. Observe catheter tip for nicks, which cause mucosal trauma, and increase frequency of oral hygiene.